Hi, this is Dr. Randy Grill, nursing home dentist, and this video is for dentists that are being hired into a very specific program. In fact, it's so specific, when I've gone to special care dentistry meetings, they don't even know about this subculture exists. It's where whether you're a dentist and you do prepaid dentistry and you register with the state, or you're an insurance company who legally has a dentist, who has a practice, who has the patients, and I'm familiar with two states, Kansas and Oklahoma, and we have to do this legally. They're my patients. However, I am funded like a PPO and HMO, prepaid dentistry, like insurance companies do, or like we can do ourselves. It costs quite a bit of money. It takes a lot of effort, and so I enjoy my relationship with an insurance company. They have basically told me do whatever is right. I've been doing this since '99, and I get calls from all over the country on CEOs of insurance companies or prepaid dentistry, whatever, from the friends I have that own the insurance company I don't work for, I work with. Without them, I don't exist, and without me, it'd be very difficult. So they need a relationship. So you are in a subculture, in a segment, or thinking about doing something, you have no clue what's involved. First of all, 100% of this money is federal and state money. This is public health dentistry. This isn't geriatric private practice dentistry. In fact, the first place we have to start is special care dentistry. You must join that. Go back to the articles in 1980 and read them forward. The same editor has been there, Ronald Ettinger, who I consider a hero. He doesn't know me from Adam, but he has been the editor, and so each year, each magazine of a couple times a year for special care dentistry, which includes geriatric dentistry, hospital dentistry, special needs in total, they build on each other. And so if you don't understand, or you haven't heard of special care dentistry, you need to get on their website. You have to join to get the back issues, and go to September, October 1984. If a person is in a nursing home, they are frail and medically complex and functionally dependent. Nobody that has ever come into your office has those categories. You can have homebound people come in with great effort, but if you treat my medically complex people like you do geriatric patients that wander into your office, you're going to hurt people. If you talk to a seasoned DON, I mean one that started as a CNA and then went up to a Med Aid and then went to school and got their LPN and then an RN, and they've been in this 20 years. If you ask them how many people have died that you know of under your care within 24 hours of going out to a dental or medical program, and you'll get them to turn white because they haven't connected the dots. If you do a rubber dam or set back somebody with SOB and COPD, and if you don't know those numbers, you've got some reading to do. So they can actually drown, but they don't die for 12 to 24 hours. And so I always carry American Academy of Oral Medicine. You must be a member of it. You must get their 2 little clinical guides, and you just skim through it once, and then when you have your first COPD diagnosis, and all my patients are in nursing homes. They have had no money for a long time because they have to be on Medicaid and Medicare. This is the subculture I'm in, where insurance is paid for by the government for these people. Now, the kids have to write the check, but then the nursing home deducts that money that they wrote for the check for this prepaid dentistry or insurance, and then the home gets reimbursed by the government 100%. This is public health dentistry. It was designed not to do comprehensive dentistry. There's 4 levels of care, and that's another article. I don't have time to go over this, but in volume 20, number 3, 2000, several, Dr. Isaacson, Rita Isaacson, and several others wrote on the different levels of care. Comprehensive, which is what you're used to. That's what they teach. Geriatric dentistry, in fact, is defined in this last article by Geriatric Dental Curriculum and Needs for the Elderly in September, October 1984, defines that everybody in a nursing home is frail, medically complex, and so forth. This, written in 2000, gives you the 4 levels of care. You were only taught comprehensive dentistry, whether you worked on a 1-year-old or a 90 or a 100-year-old. And the 100-year-old that walked into my practice, and I practiced from 76 to 1999, before I tried to retire, and got involved in this just by a fluke. In fact, my wife was tired of me being at home. She was managing a dental practice and threw the newspaper at me and said, call this guy in Chicago. And we've had a good relationship ever since. It changed my life because as a big dog in dentistry, I ran out of purpose. You know, I could be replaced. You can't be replaced in this. The number of men and women dentists I've tried to have changed, it's like a revolving door. I finally have a partner, and hopefully you're not listening to this because I ran an ad because something happened to my business partner, is a dentist that gets it. He knows how to take care of it. He knows we can't do comprehensive. You would need a van, or the government would have to spend $100 grand in each nursing home to make a clinic comprehensive enough. And so you have to take everything you can. If you don't know what Jane Chalmers, who is former Jane Chalmers, dentist from the University of Iowa, talked about MID and ART. And MID has different minimal invasive dentistry. If you got a laser, you're doing MID. If you've got this, you're doing MID. If you've got that, you're doing MID. It's got lots of definitions. But for nursing home dentistry, for those that are frail, medically complex, MID means more like Edwina Kidd, the karyologist, has a PhD in karyology in England, has designed a program. Dr. Ron Lamb of World Dental, I can't believe it. Anyway, out of Tulsa, Oklahoma, World Dental Mission has a school in Ethiopia teaching art. Art is incredible, and that's what I can practice in nursing homes. If you open jaws, set people back. Yesterday I was doing 2 fillings. The person wouldn't allow me to cut off a plunger cleft, so one of them failed. But thank goodness I had used Fuji 9 Extra, which has fluoride in it, and it stayed bonded, so I'm not worried about having to go back. She wouldn't even let me smooth off a plunger cusp. All I could do was spoon out and that. And so the reason we use materials that we do and not amalgam or composites is these people bail out. 1, they don't want to be here. Their kids got them the program. 2, they're old. They've earned the right to be cranky. And the list goes on. Then you do their medical challenges, which they're things that if you're in there over 5 minutes, you're in real trouble. So clinical guides, special care dentistry, and you need to read every geriatric article from 1980 forward just to get your sea legs, or you're going to hurt people. And the number of people that have died waiting for me or the night before, I cannot count. In fact, I've even got stories about a daughter that forced me on a prophy and somebody had a TIA. That's a horrible experience because I went beyond what I thought. These people are more fragile than you can ever imagine. Had a son, I was going to do an extraction on a mobile tooth, lift up the mother, broke 2 of her legs from OPD. So if you don't have that levels of care and that you know you are a public health dentist, and I even had one dentist say that her state requires an x-ray before she can touch it. What a lie. Oral surgeons, to save lives, we have risk rewards. We have OSCAR. If you don't know what OSCAR is a treatment plan protocol which puts in reality of how long the average male, 73% of all males die within 6 months of staying in a nursing home. My practice has them for about 3 months, and I either have to end or go to part 2. So study, I'll do more videos, watch these videos, or you're going to hurt people. We are not doing comprehensive dentistry, but limited, palliative, and emergency. Thank you. Dr. Randy Grill, Nursing Home Dentist.